Hello, my name is Reagan Zimmerman, and I will be sharing my week 5 presentation on the evolution of nursing informatics. What is nursing informatics? Nursing informatics is a specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom in nursing practice. According to the American Nurses Association, it supports nurses, patients, and healthcare teams in decision making across all roles and settings. The primary goal of nursing informatics is to enhance patient outcomes by optimizing information management and communication. It plays a crucial role in evidence-based practice, clinical decision support, and health technology implementation. As nurse leaders, understanding this field enables us to influence policies, design workflows, and improve patient care quality through strategic use of technology. Brief history of nursing informatics. Nursing informatics emerged in the 1980s, guided by the rise of technology. This influence helped create electronic health records, along with the need for structured data in patient care. Initially, nurses used technology for documentation and administrative purposes. As electronic health records, or EHRs, became widespread, the field evolved into a more analytical and strategic role. The 1992 publication of the Scope and Standards of Nursing Informatics formalized the discipline. In more recent years, advances in artificial intelligence, or AI, have driven the field into a pivotal role in healthcare. Today, nurse informaticists are essential in clinical systems designs, interoperability, and data analytics. Evolution of the specialty. The evolution of nursing informatics reflects both technological innovation and shifting healthcare priorities. Initially focused on automating routine tasks, it has grown to encompass strategic leadership, data analytics, and patient engagement. Certification programs, such as those offered by ANCC, now support the professionalization of the field. Nurse informaticists today are involved in shaping health IT policies, implementing clinical decision support systems, and enhancing telehealth services. With the rapid growth of digital health tools, the specialty is evolving into a leadership role that requires advanced practice registered nurses, or APRNs, to be both clinically proficient and digitally literate. Impact on nursing leadership. Nursing informatics empowers nurse leaders to make data-driven decisions that improve quality and efficiency. Utilizing analysis of data for informatics, leaders can track clinical trends, patient outcomes, and staffing metrics to support safe and cost-effective care. Informatics tools also enable real-time performance dashboards, aiding in leadership, accountability, and transparency. As change agents, nurse leaders use informatics to streamline workflows, advocate for policy reform, and promote interprofessional collaboration. Informatics naturally cultivates a culture of innovation rooted in evidence-based practice, which enhances leadership's capacity to guide organizational transformation and elevate nurses' role in strategic planning. This support for nurse leaders improves outcomes and provides more opportunities for growth. Impact on clinical practice. In clinical practice, nursing informatics facilitates safer, more efficient care. Tools such as clinical decision support systems, or CDSS, barcode medication administration, and infusion pumps reduce errors and support clinical judgment. These extra checks provide a second line of accuracy to ensure the safety of the patient is not jeopardized. This also supports the nurse, for human error can happen, but informatics provides additional help to ensure the correct medication is being administered to the correct patient. Nurses use electronic health records, or EHRs, to document care in real time and access patient histories, labs, and diagnostics quickly, improving continuity of care. As frontline users, nurses influence how technology is adopted and optimized, ensuring systems meet patient needs and uphold standards of care. Impact on administration. From an administrative perspective, informatics enhances operational efficiency and financial oversight. Nurse administrators utilize informatics to manage resources, measure productivity, and evaluate care quality. Data analytics support the development of quality improvement initiatives, risk management strategies, and compliance with regulatory standards. This is important to assess for compliance reasons and analyze the performance of the unit. Informatics also aids in managing human resources, such as optimizing staff models based on acuity and workload. Advanced nurse leaders are instrumental in selecting and implementing health IT systems that align with organizational goals and nursing priorities, ensuring that systems are user-friendly and support clinical outcomes. Impact on nursing education. Nursing informatics significantly influences education by integrating technology into teaching and learning. Simulation labs, virtual reality, and online learning platforms enhance clinical reasoning and procedural skills. This became especially prevalent during the COVID-19 pandemic. Informatics competencies are now part of a national nursing curriculum, preparing future nurses to work in data-rich environments. Educators also use learning analytics to assess student performance and adjust instruction. As nurse leaders, it is our responsibility to ensure faculty and students are proficient in informatics tools and critical thinking skills necessary for safe, evidence-based care in a digitally enabled healthcare system. Impact on nursing research. Informatics has been revolutionizing nursing research by enabling large-scale data analysis, access to EHRs, and real-time outcomes tracking. Nurse researchers use informatics to identify patterns, test interventions, and validate clinical practice. A concept that nurse researchers may utilize informatics for is predictive modeling, which allows researchers to anticipate adverse events and optimize care pathways. Ultimately, the goal of providing patient care in a safe manner is important when analyzing these trends. Informatics also facilitates collaborative research through shared databases. As advanced practice registered nurses, we can use informatics to generate evidence that informs policy, improves care delivery, and strengthens the nursing profession's scientific foundation. Government policies strongly influence the development and implementation of health information systems. Regulations such as the Health Insurance Portability and Accountability Act, also known as HIPAA, govern patient data, privacy, and security. Another regulation is the 21st Century Cures Act, which promotes interoperability and prevents information blocking. Additionally, Medicare and Medicaid reimbursement models increasingly require providers to demonstrate meaningful use of certified EHRs. Clearly, there are many policies and regulations that affect informatics. It is important for nurse leaders to stay informed on regulatory changes and advocate for compliance while ensuring usability and safety. Informatics also plays a role in shaping internal policies that align with legal standards and ethical practice. Nurse-led innovation in informatics. Within the field of informatics, nurse-led innovation has created a significant impact. Nurses are contributing by developing digital tools, mobile apps, and care coordination platforms tailored to meet patient needs. One example includes nurse innovators who have created telehealth protocols that improve access to care in rural areas. Through innovation labs, nurses also contribute to the design of EHR features, improving system usability and reducing documentation burdens before implementing new systems. Informatics empowers nurses to drive solutions to clinical challenges, making innovation a core competency of modern nursing leadership. These advancements ultimately enhance care quality, safety, and equity to better assist nurses in providing care. Looking at a case study, let's investigate the role of informatics within improvement projects. At my hospital, a nurse-led quality project was implemented with the goal of improving sepsis timer documentation. Our previous compliance levels were 20% below the state baseline, so our CNS implemented education and awareness on the topic. EHR data was obtained in the department to compare our previous compliance to present day. This data and education help nurses identify risk factors and symptoms of sepsis to help guide care. Using this knowledge, targeted rounding for sepsis documentation was brought to awareness on the floor. As a result, our sepsis documentation is now 15% above baseline over the last 6 months. This example illustrates how nursing informatics transforms raw data into actionable knowledge, leading to measurable improvements in patient outcomes. It also highlights the nurse's role in clinical analytics, interdisciplinary collaboration, and continuous improvement. In conclusion, nursing informatics is an evolving specialty that empowers nurses to lead change across clinical, administrative, educational, and research domains. As advanced practice registered nurses or nurse leaders, our understanding of informatics equips us with the tools for improved decision making, influence policy, and innovation. With continued advancements in digital health and growing regulatory demands, informatics will only increase in importance. It is essential to utilize informatics as a resource and facilitate understanding among nurses to improve patient outcomes. In a world of technology continuously emerging, it is essential for nurses to incorporate informatics to their advantage. It will always be relevant and support nursing care. These are my references. Thank you.